Hi, everyone. Welcome to the Michigan Parkinson's Foundation Virtual Education Series. I'm very excited tonight to welcome our speaker, Dr. Amelia Heston from University of Michigan, a movement disorder specialist there that's going to talk about Parkinson's and exercise. But before we get started, I just wanted to mention a couple of things. One, we've been getting a lot of people attending these, and sometimes we don't get to all the questions. The best way to ask a question is definitely going to be using the chat feature at the bottom of the screen, or if you use the raise hand feature, and we will try to get to as many questions as we can. But before we get started, I did want to introduce to you Angie Ludwa. For those of you who do not know, Angie is our director of exercise. Angie brings a wealth of knowledge and talent to the Michigan Parkinson's Foundation. Angie and I have worked together in some kind of fashion over the last 20 years. And now I'm honored that I get to work with her every day. But I thought I'd introduce Angie, turn it over to you, and maybe you could talk about what we offer at the Michigan Parkinson's Foundation before our talk.
Yeah, for sure, Julia. So nice meeting every one of you here. So the Michigan Parkinson's Foundation offers I'm pinned here, a live Zoom exercise classes Monday through Saturday, and they all are at 10 a.m. And I know some of you on here join those, but they are taught by physical therapists who are certified in power and Parkinson specific exercises. That's Monday through Thursday. And then Friday morning is a yoga class taught by Mindy, who's also certified in yoga. And then Saturday, every other Saturday, the students from either Central Michigan or U of M Flint teach those classes. So that's pretty fun to exercise with the students. And then also, before I forget, on Monday at 1 o'clock at our office, I teach an in-person exercise class from 1 to 2, and that is free. So if any of you live in and around Southfield where our office is, you're more than welcome to join us. It's at 1 o'clock. Yeah, and we are starting to get more classes in the state of Michigan. That's our goal, is to start in-person classes in Michigan. And we do have one that has started in the Port Huron area, for those of you from Port Huron. And we are in the process of getting that flyer sent out. So hopefully if you live in the area, you'll be getting an email soon from us. So yeah, we would invite all of you to join.
Thank you, Angie. And also, we also encourage a lot of people that if you're attending an exercise class or a dance class or anything like that in your community and you think we should know about it, please let us know about it. We get a lot of calls to the office wanting to know about in-person activities, and we're all in this together. So if you do know of it, Angie or I both welcome that phone call to connect.
And on our website is a listing of all the in-person classes in the state of Michigan per county. So if you're interested in an in-person class where you live, go to our website and look under your county, and it will list all those in-person Parkinson specific classes. So hopefully there's one near you.
Right. Thank you, Angie. Didn't mean to put you on the spot.
Oh, no, that's good.
You know me.
Yeah. Right.
All right. Well, I'm so glad everybody could join us. We have about 50 people online right now. Hopefully we're not going to have any IT difficulties. So with that, we're going to get right into it and be very respectful of Dr. Heston's time. But Dr. Heston comes to us from the University of Michigan, where she is a movement disorder specialist. She did her neurology residency at U of M, as well as her movement disorder fellowship. I will say, I think congratulations are in order to University of Michigan, as they were just awarded a Center of Excellence by the Parkinson's Foundation. So we're very excited to hear what's happening and what's new, and to be a strong partner. So without further ado, I will go ahead and turn it over to you, Dr. Heston.
Sounds good. Thank you so much. Can you hear me all right?
I can hear you all right.
All right, sounds good. Well, thank you for the introduction. So I'm Amelia Heston. So again, lucky to get to train through the University of Michigan, their great neurology and movement disorder program. So I wanted to talk to you all about the very important topic of exercise and Parkinson's disease. I think that it's one of the most important topics we can go over. Before I get started, other than my background, I guess academically, I also want to go through kind of my personal background too, and that in terms of my family history, I saw my grandfather go through Parkinson's disease as well as his sister, as well as their cousin. And then my grandmother, my grandfather's wife, also was more recently diagnosed with Lewy body dementia. So this is something that, a lot of family, personal motivators to help, and work with Parkinson's patients. So, alrighty, I'm going to go ahead and get my PowerPoint up here. Give me one moment here.
No worries. And for the gallery, I just want to make sure everybody can see and hear us well. And if you can, maybe give me a thumbs up.
All right, and is that moving okay?
Yeah.
Everyone can see that. Perfect. Okay. All righty, so I have no relevant disclosures. So I just wanted to go into first my outline. So kind of just the outline of this talk. So first I want to spend just a little bit of time on just some basic background information of what is Parkinson's disease. I know, there could be people who have been to many of these talks or people that this is their first talk. Then I'll go over kind of what are the benefits and what can we get out of exercise for patients with Parkinson's disease. We'll go over different types of exercise and the question of what is best. We'll kind of discuss some barriers to exercise as well as future directions of exercise research. And then lastly, I'll just discuss some additional notes on, maybe more practical parts of this, some of my personal experience, and then additional resources. I've tried to combine a combination of both general and practical information, as well as things that I might present, say, in like an academic setting, because I know people coming to this talk might be from a variety of different backgrounds and have read varying amounts of literature already on Parkinson's disease. Lastly, I want to emphasize that really there is so much literature out there on exercise and Parkinson's disease, and some of these subtopics could even be their own talk. So even though it seems like one niche, it's actually really still just an overview. All right, so just going a little bit into what is Parkinson's disease. So, we consider this to be a slowly progressive disease, which primarily affects different parts of the nervous system. So it's felt to be at least in part related to abnormal buildup or basically clumps of proteins, similar to other progressive disorders that we see. And the hallmark being these kind of buildup of this abnormal protein called alpha-synuclein, in the most notably in the brain. There are many different proteins that are normally made throughout the body and are used for a variety of different things. And we don't completely understand why this abnormal buildup happens, but it's thought that that is part of what prevents the brain cells from working properly, or neurons. There are kind of two big categories that we think of in terms of symptoms, and we separate those really into motor and non-motor symptoms. The motor or movement symptoms are the types of symptoms we typically think about in terms of Parkinson's disease, and that's where our four cardinal features of Parkinson's come from that help us with our diagnosis. And this includes bradykinesia, which is slowness of movement. That's what we're checking when we have people tap their fingers and open and close their hands or tap their heel. There's rigidity, which is this increase of muscle tone with passive movement, and that's what we're checking. That's the stiffness or cogwheeling that we check when we move someone's wrist. There's tremor, and that's specifically going to be tremor at rest, so tremor when you're not using your arms or legs. And then postural instability, or the difficulty in being able to maintain a posture or stance, especially if there's some kind of disruption. So that's when we're doing the pull test in the hallway. This, of course, doesn't include all of the non-motor symptoms or non-movement symptoms that many people experience to varying degrees. That can include the autonomic symptoms or kind of dysautonomia or difficulty with the automatic part of the nervous system, and that can cause issues with constipation, maintaining a normal blood pressure, or urinary symptoms. The neuropsychiatric symptoms, which are also pretty wide in terms of mood and memory and thinking symptoms or cognitive symptoms. And then, of course, other symptoms that can include different forms of sleep disruption and changes in smell or taste. And I think it's relevant just going over all these symptoms in terms of thinking forward, which of these symptoms do we think of being affected by exercise? And so going a little bit further into Parkinson's disease. So it's thought to be at least in part related to loss of dopamine producing cells in the brain, especially in these deep middle parts of the brain that control movement. And dopamine is just one of the chemicals, one of the important chemicals that helps the brain function. And so this loss of dopamine is what causes these motor or movement symptoms that we think about that I described on the last slide. And this is what really a lot of our treatments focus on, is either replacing or kind of augmenting or promoting this dopamine in the brain. And that's primarily what carbidopa, levodopa, or Sinemet will do. But this only, again, treats the movement symptoms. And these medications don't necessarily change the course of disease. And of course, that's what we're all looking for, is something that will actually change the course of disease. So in terms of what we're good at treating in terms of Parkinson's disease, so this medication is excellent at treating rigidity. That's one of the things that most consistently improves. We're pretty good at treating the slowness or the bradykinesia. We're pretty good at treating tremor, constipation, blood pressure related symptoms, and mood symptoms, but we know we're not as good at treating cognitive symptoms, some of the walking and balance symptoms that people experience that they note that don't respond to the medication, such as, say, freezing that doesn't respond. And then of course, this doesn't necessarily change progression. So I think that when we're thinking about what would be the features of something that changes progression of disease, that treatment that I know that we're all wanting, we're all looking for. I think that when we're thinking about exercise, it's important to think about kind of what makes a disease modifying treatment. So I think the features that you look for are something that would hopefully either prevent development of the disease or disorder, and also something that would either significantly slow, stop, or even reverse the course of Parkinson's disease in people at varying stages to varying degrees. And so it's just something to kind of keep in mind as we're thinking how, does exercise play this role? Is it something that's disease modifying? Does it fit some of these categories?
Up in the right-hand corner.
So in terms of thinking about the benefits of exercise, so I guess first, since there's the most research in just exercise in general and just the general population, including older adults, I wanted to go over that first just to understand kind of the general benefits of exercise. As for the most part, a lot of our patients with Parkinson's disease will be older adults in their 60s and 70s. And so it's important to understand how exercise can help in general. So exercise can improve cardiovascular health. That helps reduce risk of stroke, risk of heart attack, can lead to improvement in blood pressure, cholesterol, better control of sugar. And this is especially noted with aerobic exercise. And we'll be getting into different types of exercise later in the talk. They've even shown that, especially in adults under 75, they still can have comparable improvement in measurements of aerobic fitness as younger individuals, and that people over 75 can still have that improvement even if it's just at a slower pace. Exercise also can help combat muscle loss, which is incredibly important. We know that people across the board start losing muscle mass in their 30s and 40s. And that can accelerate after 65, with peak muscle loss being even up to maybe 50% at 80. And so this is a rate of even just shy of 10% muscle loss per decade. So strength training has been shown to be able to combat this muscle loss, as well as help reduce pain from things like arthritis, improve bone density, and help people improve their posture. Balance training has been shown even in people without Parkinson's disease to help reduce fall risk. Exercise is also shown to help improve quality of life of older adults, and also help to maintain independence in daily activities, which is very important. But it's fair to ask, well, if I'm not the typical older adult because I have Parkinson's disease, or, say if I'm someone with Parkinson's disease who has young onset Parkinson's disease, do these benefits still apply to me? How does exercise still apply to me if I don't fit in this group? Which is a fair question. We know that there are some differences, of course, in people with Parkinson's disease compared to the typical older adults, and that they can have, of course, reduced walking speed, less total steps per day, and higher rates of inactivity. So it's really important to look into how exercise specifically affects this group, and we'll get into that in a little bit. Next, I wanted to talk a little bit more specifically about the benefits of exercise in terms of just neurodegenerative disease across the board, and specifically its protective nature. So exercise is felt to be protective against neurodegenerative disease, and that's going to be progressive diseases, things like Parkinson's and Alzheimer's. And there's multiple studies that show that lifelong exercise can be protective against the development of these disorders. Specifically, there are studies that looked at exercise in people in their 30s and 40s being protective against the development of Parkinson's disease. Exercise has also helped to reduce neuroinflammation. And so I know that I said that protein kind of clumping or abnormal protein buildup is part of Parkinson's, but we're also learning that neuroinflammation is also something that's increasingly recognized as possibly a role in Parkinson's disease. So when someone exercises, there are chemicals released in the brain which can help to reduce neuroinflammation. And so I know I'm leaving this kind of vague, but again, this is one of those topics, neuroinflammation, that could even fill an entire presentation just on that. Exercise is also felt to increase blood flow to the brain, and that's specifically a little bit more with aerobic exercise. And that has been shown across the board to improve cognition and even just healthy older adults. And one of the areas of the brain that's frequently cited as getting this increased blood flow is something called the hippocampus, which is a really important area of the brain for memory. And there's even some thought that that area of the brain can even increase in size with exercise. Exercises also help to improve neuroplasticity, which is just the ability of the brain to form new connections. And we'll get into that a little bit more in the next slide. So there are two important chemicals that we think of in the brain that are increased with exercise. They're called BDNF and GDNF, and that's basically brain-derived and glial-derived neurotrophic factors. And these will focus largely on BDNF, and there is a lot of research on this as well. But it's thought to be a very important chemical in the brain that's important for that neuroplasticity, or that ability for the brain to form new connections. And it's also possibly even important for neuroprotection and maybe even neuroregeneration, and also very important for learning and memory. So people with Parkinson's disease are shown to have less of this BDNF in their brain. So they looked at, in mice who they have, mouse models that are made to look like they have Parkinson's. They've showed that when they have them exercise, especially with high intensity exercise, it can actually increase this BDNF in the brain. And then and specifically it's found to increase even nerve cells, and especially in those areas deep in the brain that are affected by Parkinson's, and also to increase the dopamine levels. So this research was also followed by, of course, measurements in people with Parkinson's disease, and that showed that they also had increase in the BDNF, and that was increased in the blood of people with Parkinson's disease even after just one 30-minute session of exercise. So this increase is also associated with, they would see improvement in motor symptoms in these people who also were having this notable increase in this chemical in the brain. So to get a little bit more into kind of the benefits of exercise, if we're looking at different symptoms of Parkinson's disease, so those groups of symptoms that we looked at the beginning. So getting more specifically into benefits of exercise in terms of different symptoms from neurologic diseases in general. Even outside of Parkinson's disease research, exercise has been shown to improve symptoms in multiple neurologic disorders, so including Alzheimer's disease, ALS, Huntington's disease, and other ataxia or balance-related disorders. So much of the exercise literature in Parkinson's really does focus on movement symptoms. So a lot of this exercise literature shows that there's improvement in movement symptoms as measured by this UPDRS, or Unified Parkinson's Disease Rating Scale. And I just want to make people familiar with that term, because it is something that could come up as you're reading through different information about Parkinson's disease. It's this important scale that a lot of us will use in research, and we'll even often use parts of it as part of the exam as well, that looks at different features, including your walking, tremor, slowness, stiffness, and give it, actually quantify how much we're noticing throughout the body. So, exercise has been shown to help improve, people, when we rate patients on this scale, has shown improvement in that. It's shown improvement overall in walking speed. It shows there's improvement with different measures of balance, and then overall reduction in fall rates in people with Parkinson's after exercise. In terms of, and these improvements can be also both immediately after even a single 30-minute period of exercise, to having also continued benefits with symptoms over a year with continued exercise. Typically, these are going to be, a lot of these studies are looking at either moderate to vigorous exercise. So outside of the many benefits for movement symptoms, what are the benefits for some of the other symptoms of Parkinson's? So while movement is important, of course, and affect quality of life, cognitive symptoms are usually also a symptom of concern for patients and people with Parkinson's disease. So exercise has been shown to improve cognitive function in people with Parkinson's disease, and also in the general population. So they studied exercise that can impact memory and thinking, including aerobic exercise, treadmill training, dance, and especially tango dancing, cycling, stretching, and different strength training. There was, the very kind of big trial called PPMI, which is this biomarker trial through the Michael J. Fox Foundation, which some people may have heard of. They even noticed that there's a connection between, decreased physical activity and possible progression of cognitive symptoms. They felt like they were even able to control for other factors and show that really this physical activity might be something that is leading to cognitive decline. So when they looked at, different types of cognitive decline, we actually look at different, not just cognitive decline in general, but we look at different facets of memory thinking because there's lots of different parts of that. So there's, with exercise, there's been shown to be improvement in both attention, people's processing speed, visual spatial function, and then executive function, which is kind of our frontal lobe functions that help us organize and multitask. There's even thought to be improved visual. We talked about largely kind of more intense exercise, but even a study that looked at just passive cycling with no resistance that showed that there was some improvement in visual spatial function in people who were just passively cycling. So in terms of mood symptoms, there's also more specifically some benefits for depression that people will see both in the general population and in people with Parkinson's. Although notably, a lot of those studies looked at benefit in terms of exercise, exercise in a group setting. So it's possibly there's a social component of that that's helpful. And then sleep can also be improved with exercise. And so we know that people with Parkinson's disease have a variety of issues with sleep. And in terms of, there was, one study that looked at comparing people with Parkinson's disease and people without, and they showed that people who were exercising with Parkinson's disease could even improve their sleep quality or reported sleep quality beyond the people who didn't have Parkinson's disease who weren't exercising. So a lot of potential for improvement in sleep. And so I think in terms of what we kind of have the least information on, so there seems to be the least information on kind of these autonomic symptoms, or those that kind of dysautonomia or difficulty with the automatic functions of the nervous system. So we do have some literature that there is some benefit for orthostatic hypotension, or those kind of drops in blood pressure when people stand up, or low blood pressure that happens that causes dizziness, and some improvement in heart rate variability that can occur with exercise. I think the one thing to note about that, though, is some people did feel that their orthostatic hypotension or that drop in blood pressure might feel worse during exercise, even if things were overall improved afterwards. There's very little information on kind of constipation and urinary symptoms. There's some data that just in general exercise is helpful for constipation, but nothing really that helps in terms, no data to prove that it's helpful in Parkinson's disease. And for urinary symptoms, there's very little data on exercise in that. I think that, in terms of overall quality of life, though, a lot of people feel that they have overall quality of life improvement, even in Parkinson's disease with regular exercise. So in terms of what types of exercise, so I counsel at basically almost every appointment for all of my patients that exercise is important. And the most common question I get is, well, what type of exercise? So I think that even to kind of go through in the beginning, so my answer is typically going to be, that there's, even though we have a ton of information about all these different exercises, adherence with exercise is one of the hardest things for a lot of people, even without Parkinson's disease. And so I think that most of the time I'll say, even though we have, evidence for different types of exercise, the most important thing is finding something that you enjoy and that you'll stick with. So I think that ideally, though, there's, if there were no barriers to exercise and adherence to exercise wasn't an issue, we'd probably recommend a type of well-rounded exercise regimen that does have moderate to vigorous aerobic exercise. And so we'll go a little bit into different types of exercise. So I think, and just knowing there is a little bit of overlap. So for example, rock steady boxing is probably a combination of aerobic and anaerobic. So you can even do one exercise and get a couple different things out of it. So aerobic exercise versus anaerobic exercise. So aerobic exercise is going to be typically things like walking, cycling, running, even can be gardening, while anaerobic exercise will usually be things like, if anyone's heard of high intensity interval training, sprinting, or very heavy lifting. So we talked a little bit, you can even split it down in more categories. So we already talked a little bit about what aerobic would be, but there's also strength training, stretching, and then balance-based exercises, which a lot of times will focus a little bit more on, say, things like yoga or Tai Chi. But again, there can certainly be overlap in some of these things as well. So in terms of going into aerobic exercise, so we've already talked a little bit about how aerobic exercise seems to have a lot of benefit, especially moderate to vigorous exercise. An improvement not just in cardiovascular health, but also brain health in general, might impact progression of disease, and also can lead to improvement in motor symptoms and cognitive symptoms for people with Parkinson's disease. Notably, the benefits for balance might be a little bit more mixed. And again, that's where there is, ideally an exercise regimen would have some components of both aerobic exercise and then also some of balance training. So I think even notably though, there is one study that looked at a special type of MRI after people had cycled even for one time. And they did notice that there are patterns of increased kind of activation in certain parts of the brain that are very similar to if someone had just taken a dose of carbidopa, levodopa, or Sinemet. And that those areas of activation were even greater with people who are pedaling faster. So generally recommend some type of aerobic exercise about 3 to 4 times per week for about 30 to 45 minutes. That's usually moderate to vigorous intensity. So I think I want to go over if you're recommending these types of intensity, what does that really mean? So in a lot of what we've looked at, there's specifically moderate intensity tends to be defined as being about 60 to maybe 65% of this max heart rate. And we'll go over that in just a second here, where high intensity tends to be something between 80 to 85% of maximum heart rate. So there's different methods to calculate that. And some people will go through and calculate this and figure out what their ideal heart rate is and use that if they're exercising with different machines or different heart rate monitors. So you can do this 220 minus your age, and that can equal the maximum heart rate. And then you would multiply that by the percent to figure out kind of what the range is. There's some thought that even though that calculation, if you were to look this up, is going to be the one that you'd find most commonly, there's some thought that maybe that's not the best way to estimate heart rate, especially maybe in older patients. And so that's where this kind of slightly more complicated 207 minus age times 0.7 calculation comes in. So I think that for some people, we know that the medications can affect heart rate. We know that Parkinson's can affect heart rate and cause this heart rate variability. And so people might find that, maybe measuring their heart rate is either just too complicated, or they don't have access to a way to do it, or maybe just isn't a reliable way for them to measure their intensity of effort. And so that's why these two kind of pictures on the side are different scales of rate of perceived exertion. And these are something that even if you've gone to a local gym, sometimes they even have something like this posted there. So this first one that I think is a little bit more complicated and obviously less colorful, the one at the top, usually high intensity is considered somewhere between 14 and 17. It's kind of an odd scale that's 6 to 20. And so there's this kind of modified, easier scale that goes from 1 to 10 that has, it's more colorful and I think a little bit more straightforward. And so for that one, usually it's going to be the vigorous activity will be 7 or 8 or maybe 9. So in terms of moving on from kind of aerobic exercise, so there are balance exercise and balance training can also be very important. So there are multiple types of exercise though that can be involved in balance training. So that can be different types of weight training, different types of specific balance exercises, as well as gait training. And of course can include other exercises like yoga or Tai Chi. Overall balance training can lead to improvement also in the UPDRS score. Again, that's that kind of special score we use to look and actually quantify how much movement symptoms people with Parkinson's are having. But it also improves scores of balance, speed of walking, and importantly can also improve fear of falling and improve fall rates. And I think one thing that's notable is that, even with a session, going through say like a physical therapy round or a couple sessions of balance training has been shown to even show reduction in fall rates, possibly even up to 85% over the next 12 months. And so that's always something that's always a goal, I think, for a lot of people is how to prevent falls. And so that's why, aerobic training is important, but adding components of balance training is likely very important too. So I can't, of course, go over an exercise talk without at least talking about LSVT, or the Big and Loud program. So this was a program that was originally used to address kind of low volumes of speech and to help people with speech disorders related to Parkinson's disease, but was expanded to include physical and occupational therapy. So it's a program that kind of that focuses on kind of recalibrating movement and speech to help overcome the symptoms of Parkinson's disease. So with this program, they also studied this program as well. And there's improvement in walking speed, stride leg, measures of balance, And again, that UPDRS scale also improves with the LSVT or big and loud program. Some studies have even, suggested that maybe there's better improvements compared to, say, some things like aerobic exercise. But again, a lot of these studies don't look at, say, overall progression of disease. So again, that's where I think all of these different types of exercise have their own benefits. And I think that in terms of, I do usually recommend all my patients to do the LSVT or big and loud therapy either every year or every other year. And usually recommend them having, even establishing with a physical therapist who's familiar with this after the first appointment where they're diagnosed. So I think I also wanted to bring up, when I counsel on exercise, sometimes I'll hear the phrase, I ask, what kinds of exercise are you doing currently? So we can kind of get into the details of it. And they say, well, I'm not exercising, but I stay active. Isn't that enough? Do I really have to have an exercise regimen? And this is something that comes up a lot, and I kind of wanted to address this directly. There is actually one study out of U of M that looks specifically at this question of staying active. So they looked at both exercise physical activity and non-exercise physical activity in people with Parkinson's disease. And they did find that there's a link actually between non-exercise physical activity and not necessarily that exercise, but non-exercise physical activity was associated with a lesser severity of movement symptoms in Parkinson's. And they felt like even when controlling for multiple factors, that it wasn't just that people with more symptoms were less able to engage in these non-exercise physical activity. They did feel that it was a protective factor. So of note, this looked at just a snapshot in time. So again, doesn't look at progression in any way, which is something that's very important. So while there's some truth behind this idea of that staying active is probably also important, I still don't think that it's necessarily something that can replace a dedicated exercise regimen. So again, it's something that I think for a lot of people is also hard to quantify. You're staying active, but how much? Does that vary depending on the weather? And so actually having a dedicated exercise regimen guarantees that you're getting a certain amount of physical exercise every week. So I think I want to go over a little bit of, we talk about how important exercise is. And I think some people leave that part of the talk and they say, okay, I get it. Exercise is really important. But I think the most important part of that is going to be how do we help with adherence to exercise, since that's one of the hardest things. So we know that across the board in US adults, even though exercise is recommended for basically everyone, we know that basically a little less than half of American adults are participating in some form of regular exercise. And that when we're looking at people under 65 or over 65, that number drops to maybe about 10 to 15%. So this isn't, it's not a you problem. It's this is across the board. We have, issues with adherence to exercise. And so I'd say it's basically normal. I think it's normal not necessarily to feel motivated to exercise. So in terms of kind of understanding barriers and motivators for exercise. So there's one study that looked at people with Parkinson's disease to understand different factors that might be barriers or motivators to exercise. So they noted that, in terms of barriers, the biggest barriers were lack of perceived benefit, lack of time, fear of falling, kind of poor health from other health related, medical problems, pain, and then also limited access to opportunities for exercise. Other barriers that this paper didn't discuss that definitely come up though are things like apathy or that kind of low motivation to do things that people might experience, or depression. They also noticed a difference in between age groups. So a lot of our young onset Parkinson's, people with Parkinson's disease who are young onset might notice lack of time is really the biggest barrier for them, while our older patients might notice that other health related issues might be the major barrier. I think the one thing is that they found that really barriers were actually what influenced people to were more influential overall than motivators. So the more barriers someone had were much more influential than their motivators. And the greatest barrier that they found was low outcome expectation, or basically this feeling of, I don't think I'm going to get anything out of exercise. I don't think there's really anything in it for me. And so people that felt like there would have benefit to exercise and that it was beneficial to them were at least twice as likely to exercise. So I think that we have some information on this, but we have even less information on, well, we know that adherence to exercise is the issue across the board for everybody, including people with Parkinson's, but we have even less data on, well, how do we help with adherence? What do we do to help improve that? So there are some, there are some trials that are out and some trials that are working on understanding how to help people with adherence with exercise, knowing that this is not an individual issue. This is an across the board issue. So again, there's some trials that look at telehealth coaching. So if there's, some kind of telehealth professional, either physical therapist or an exercise coach, is that helpful? Does that help people with their exercise adherence? Different app-based exercise type programs and other wearable sensors to see if these can help people with their exercise adherence. There's also questions about, we know that exercise is important and we're trying to basically prescribe exercise, but we don't have these kind of detailed information about, is there a minimum amount of exercise that's helpful, or is there a specific dose we should be basically prescribing, or is there even a maximum amount of exercise that we're past a certain amount, it's not actually helpful anymore? There's this pretty notable trial called SPARKS-3 that's basically trying to answer that question, or at least start to answer that question. And it's basically a trial that's comparing moderate versus high intensity exercise. And specifically, it's looking at treadmill exercise in people with Parkinson's who are not yet on any medications. And there's one group that's going to be the moderate intensity, one group that's going to be the high intensity. And so they're basically going to look over a year period, how do people in both of these groups do? They're asking them to exercise about 4 times per week for about 30 minutes, typically with treadmill exercise, and at least at a minimum of 3 times per week. They're looking at going to look at that again, that UPDRS score, or that score that helps us understand movement symptoms. They're going to look at cognition. They're looking at that BDNF, or again, that kind of that brain molecule that's important for brain protection. They'll look at inflammatory markers, because again, that's something that we were talking about, that neuroinflammation is likely something that's important, and they'll look at other imaging findings. I think that'll be a really interesting trial to see results from. In terms of resources, so what are some of the resources I point some of my patients to help with exercise in my clinic? So I think that one of the important things, so I had regularly referenced people to the exercise exercise program through the Michigan Parkinson Foundation at 10 a.m. I believe that those exercise, I always say, if you miss it, if you sleep in there, I believe they're all recorded on YouTube. There's also other exercise exercise YouTubes through Parkinson's Foundation. So I have that there as well. Of course, LSVT, big and loud therapy, which I already mentioned. And then of course, I, would be really missing out on, if I didn't mention Rock Steady Boxing, which is one of probably the most popular groups of all my patients, and something where people actually won't schedule appointments during Rock Steady Boxing. They tell me I can't schedule my appointment then. My appointment has to be at a different time. So I know that I rank below Rock Steady Boxing at this point. So, and so how does this all, we know that we can look at research and we can see what it shows, but does this actually translate? Is this actually something that I see in my patients, and is this something that we all see? And so how does this apply to kind of clinic? So it's something that I think we all see as physicians and as doctors who are caring for people with Parkinson's, is that we definitely all agree that our patients who exercise do seem to do better over time than those who don't. And I know that's echoed by many of my colleagues. So we also certainly, I've seen improvements on exam after patients have started an exercise program, or especially after they've done the LSVT therapy. Sometimes I've even had to do a double take on my notes and say, we didn't increase any meds last time? Because it kind of looks like we increased meds from last time. I have multiple patients who endorse that there's really even like immediate effects on their, pain and discomfort related to Parkinson's, which I know I didn't even really touch on that. And they really are pretty religious with their exercise for this reason, because they just feel so much better and so much more comfortable when they've exercised that day. I think that there are definitely barriers that come up for some of my patients that feel either too fatigued or feel like there's other reasons that they can't participate with exercise. And so I think the important thing is that there's ways that we can really troubleshoot that. I think one of the most important things is just if there's undertreated low blood pressure issues or that orthostatic hypotension. That's where I've seen time and time again, if we're just not managing that well enough, that can cause issues with exercise. Also issues with if people are underdosed on their medication, if they need additional physical therapy for arthritis pain that's not being managed, or if there's other issues, metabolic reasons in their labs that we need to work on something to help with tolerating exercise. I think there's also a lot of patients who kind of identify with this spoon theory, and that's something that's used for many people with chronic conditions. that affect their energy level. And that's that a lot of people feel that if they only have so many spoons or so much energy that they can spend per day. And so it's just kind of giving yourself that time to recover and to rest after you've had a day where you've exercised, especially if it's more vigorous exercise. And lastly, I really do prescribe exercise to basically all of my patients who are willing to listen to me rant about it. And I generally recommend picking something that people enjoy and that they feel like they can stick with, because that's going to be more important than trying to recommend something that someone's never done before or doesn't enjoy. So after, so when I have a talk like this in clinic and I've talked about exercise, a lot of people, or after attending a talk like this, a lot of people will feel much more motivated to start exercising after hearing all the beneficial information. But it's important to know that that motivation can wane over time, especially as they're farther away from this talk and getting busy with other things. And so it's kind of, how do you leave a talk like this and set yourself up for success with exercise? So I think the two really important things are starting slowly. So not, if you're not doing any exercise right now, starting with 4 days a week for 45 minutes is probably not going to be a recipe for success. So definitely starting slowly, even if it's just once per week. And I think the really important thing is making it a habit. I think, again, it's basically normal that people don't want to exercise. I think that's a completely normal feeling. And so if it's just building a habit that this is just something that you do at this time, then I think that overcomes the motivational issues, kind of excuses of busyness, if there's any apathy or other, depression that might be affecting it. Just building the habit is probably one of the most important things that you can do to help with success with exercise. Again, that's probably, finding motivators for exercise can also be important, although the habit I still think is even better, but kind of defining what your motivators are for exercise can be helpful and something that you can reference back to when you're feeling a little less motivated, further away from this talk. And then, outside of, just in exercise research in general, having someone that you're accountable to or accountability buddy can be helpful in having someone that helps to keep you on track and that you're keeping them on track in terms of whatever your exercise goals are. In terms of other kind of practical tips for exercise, so in terms of how to prevent injury, because that's, that is not our goal, is to have someone start exercising then has some kind of injury that prevents them from doing more going forward. So I think the important thing, other than starting slow, is really, really having proper warm-ups and cool downs with exercises. So warm-ups are actually, a lot of people sometimes think of just static stretching, or just what people generally think of as stretching as being an effective warm-up, but actually stretching sometimes can actually be a problem and promote injuries with exercise. And they're actually recommending more dynamic warm-ups. And so that can be things like, say, jogging in place or arm circles. There's lots of different things you can find if you look up dynamic warm-up. And then what to do at the end of, exercise. So it's important to give yourself cool down time to let the heart rate return back to a normal, kind of whatever your normal baseline is. And then other things that can prevent injury are then doing that, maybe static stretching, or that, what people generally think of as stretching after you've had that cool down period. I think it's, of course, really important to listen to how you're feeling and listening to your body when you're exercising. We know that, of course, people with Parkinson's disease, it can be very unpredictable. There's good days and bad days. I think the important thing is just keeping that habit. So even if you feel like it's something that is a bad day, just trying to either reduce the intensity of the exercise, reducing how long you're exercising, but just keeping that habit in place. Maybe it was a day that you're going to do something that's more vigorous, and maybe you just replace it with very relaxed stretching or something to keep that habit in place. But of course, listening to how you feel to help prevent injury is really important. And lastly, staying hydrated. So this is something important for exercise, of course, across the board, but we know that people with Parkinson's disease, their normal thirst response is not as effective. So it's, and I normally actually prescribe water, similar like exercise, for all of my patients. I usually say having a certain amount of water with basically every dose of your Sinemet or carbidopa-levodopa. But it's important to know that you might need extra hydration for exercise, especially to help combat any issues with low blood pressures while you're exercising. So again, that's where it's helpful maybe to have a water bottle that you fill to always the same amount. You always building the habit of that hydration, just like you're building the habit of exercise and doing it together. So I think another important thing is that I don't want anyone to kind of take away from this that we're trying to replace medications with exercise. So I think it's actually very important to make sure you worked with your neurologist and your therapy team to find a medication regimen that works best for you, that can help promote your exercise, as well as finding an exercise regimen that's both safe, that works for you, and is at your level. So it's, our goal is to make sure that both of these things are as optimized as possible. And last, I just want to put in basically a plug for a local celebrity with Parkinson's disease. So this is John Clausen. He's been featured for basically his kind of unique exercise regimen, and that he started powerlifting at 89 after he was diagnosed. His max deadlift was, I think, 250 pounds. This was when he was 93 and featured in 2019, but he's actually been featured in an article since then, last year when he was 97, and he is still powerlifting. He does this with a personal trainer. So of course, that's why exercise, even if you're doing something intense like powerlifting, having someone that can help coach you through doing it safely and prevent injury is really important. But as proof, it's really never too late to start exercising. So hopefully this helps you feel like you can kind of work to take control of Parkinson's by implementing exercise, and hopefully this was useful information. So hopefully that gives some time here for questions. Yeah, perfect. And I didn't see anything in the chat come through, so I didn't
Thank you so
answer.
much.
Oh, there's two.
There
Sorry.
is a comment. Yep.
Okay.
One, does your neurologist need to increase Cinnamate if you exercise?
Yeah, so I would say that your Cinnamate dose will likely be the same. Of course, this is going to be something that's personalized, so something that you would work on with your neurologist, but likely it would be something that stays the same regardless of whether you're exercising or not for most people. I think it's something that's just important to make sure that you're not. I think some people are really nervous to increase their dose. I think that's something that's common. A lot of people are always worried that they may be just, if they use it up now, they won't have it later. And I think it is important to make sure you're on a good dose that allows you to exercise as best as you can.
I just finished
Let's see.
LSPT big and having pain in my SI joint, and I have no idea what muscle that is. Can you see the
Yeah, the piriformis muscle. Yeah.
Okay, great.
Yeah, so I think it's something that's where working with your medical team to kind of understand if there's anything else holding you back from exercise. So definitely that's where I was bringing up, if there's arthritis pain that's untreated, that might be able to treat it in a different way. So I think, yeah, the cranial sacral therapy sometimes for some people is really helpful for back pain. You could always, of course, go to your family doctor and see if they have other recommendations for specific, back physical therapy, or referring to a physical medicine and rehabilitation team who specializes in, non-surgical, back pain management. So all of those are good options.
And I would also just like to share tomorrow night, we're having our exercise sampler on Zoom. And I think it's a great opportunity for anybody that wants to dip their toes in the sand. Because we're going to have Angie Ludwa, who was on our program a little earlier, our director of exercise, Allie Warner, who does Parkinson's dance, Deb Colling, who is Rocksteady Boxing superstar. And then we're also going to have Andrea Malsum do some speech therapy. These are just samplers, so it's not going to be a whole, session, but it gives you an opportunity to try out and see what you like. And I think, well, there's all these recommendations, and I have to say that was an excellent program, Dr. Heston. Things I have not heard of myself, so I love that. Thank you for teaching. But I feel as though people really need to do something more than, your couch is not your friend. I often share my story as well, and I thank you for sharing yours. My father, who had Parkinson's disease, he had it for over 40 years, and he managed it very well, but he exercised. He was a big exercise guru, and I think that was the secret. So thank you. I see we have another question in the chat.
I think it looks like the pain of the unscored Cinnamate. It's a pain. I think it's worth, let's see, when prescribed 1.5 doses of carbidopa levodopa, why are the tablets not scored? I can hardly deal with breaking them and cutting them, causing them to shatter. I think that's worth asking when you're at the pharmacy if they have ones that are scored. It should never come unscored, but we know that there's different generic producers that are making ones that are scored and unscored. But yeah, I guess if there were, I wish that was something that they knew. Never make them unscored. Then we're all splitting them. I will say I have one patient who he bites them in half, and then that's how he does it. I wouldn't recommend it, but some people will do that. I've seen it before.
And we also have some new swag at the foundation. We have these nice little individual pill boxes that are branded with our name on it. And so hopefully if you attend an event, you can pick one up. They're great, better than you having all those loose little yellow pills in your pocket where they'll break off and be all over the place. If anybody else has any questions, you're welcome to use the chat feature, or you can go ahead and raise your hand. I don't see any. I mean, it was such a good comprehensive program. I do have a question. Well, how is it referred to, the BNFD?
Oh, the BDN, yeah, the brain-derived neurotrophic factor. Yep, I know they're always really long names.
Yeah, no, that was fascinating to hear about that. And so is it believed that like exercise is what kind of activates that to increase that, or is that something
Yeah,
that is that exact? Oh, that's very
just
interesting.
that it increases that. Yeah, so when they're drawing actually a blood sample, they'll find that there's more of that. Originally, it was just in animal studies, but when they translated it to human research, they found that, yep, that it's also increased in people, and even possibly after just one like 30-minute session of exercise. So
Wow, that's great.
so I say even one round of exercise can be helpful. So
Okay, I'm gonna ask more questions. I don't see anybody raising their hand, so I hope no one minds that I'm dominating, but I want to know. For the Spark trial, the research,
Mhm.
do you know, is any of that virtual? Do they do virtual treadmill, or is that all in person? And if you don't know, I'll find out.
I don't know. I actually don't know.
Okay.
That's a good question. I mean, I would assume it would all have to be at home because it's over a year and it's 4 times a week. I don't know though. I'm actually not sure.
Yeah, I'll probably reach out and try and find out some more information. We do our the first Wednesday of every month at the foundation. I do a Parkinson's 101 for newly diagnosed, and oftentimes people, when we see them, are not on medication yet. So I'd like to get that information in their hands. Let's see, there's another question popped up. Lana, my generation study results are in. Oh, Gene. Okay, but I cannot.
I think for the PD generation.
Mm-hmm.
Yeah, I think it's just the PD generation is all through the Parkinson's Foundation. So that's just something we unfortunately don't really have any access to. It's all kind of through them entirely. But it's a great program if you can be part of it. So, free genetic testing and counseling is hard to come about. So,
Our PD 101 classes,
let's see.
sorry, no, our PD 101 classes are really designed for newly diagnosed, like I'd say within a year or two. And they are on the first Wednesday of every month at 10 a.m. at our office in Bingham Farms. And you would contact me to reserve a space. And if you're joining us from outside the Metro Detroit area, we also have a virtual option that's available. All right.
I have questions about competitive sports for pickleball. When I end up picking up the ball to continue to play, I get very lightheaded and dizzy. Yeah, so I think that's again that kind of speaks to that issue that people notice with exercise of the orthostatic hypotension. So noticing, especially with that position change, that you feel like your blood pressure drops or you're getting that lightheaded and dizziness. So I think that's one thing to make sure. Talking with your family doctor and your neurologist to help to manage that, but also that's where staying hydrated while you're exercising can really make a big difference too. So I think it's something where you both want to stay, hydrate well beforehand, so you already have all that kind of fluid, basically in your blood vessels, and then continuing to hydrate, just knowing that you're going to sweat some of that fluid out as you're exercising. How long does the BDNF increase last after 30 minutes? I don't know the answer. It's a good question. It's a very good question. I don't know. And then what about treadmills? So I mean, I think treadmill exercises can be included in aerobic exercise, and so that's a great way, especially here where we know that the weather is not great for a lot of the year and prevents you from running outside. So
Well,
Do you
I
know of
was-
any local personal trainers that specialize in Parkinson's disease? I think so. In terms of finding at least LSVT trained people. Do you mind if I just share again?
Yeah.
I can bring that up.
And while you do that, I will recommend too that you could get in touch with us at the Michigan Parkinson's Foundation. We do have some referrals, and I think it's worth mentioning as well that on our website, on our calendar of events, there's an exercise tab that lists all of the in-person and virtual exercises available that we are aware of.
So if you go to here, find LSVT clinician, and then it takes you to this. They have both the loud part, the big part, which is physical and occupational therapy, and then the loud therapy. So if you click this, put in your location, you have to agree. If you don't do that, it doesn't work. And then you can search, and then it'll show you after a little lag time all the people in your area that are qualified. And so I think it's the one important thing. Sometimes it's not always clear whether it's home care or not. So I think that's always one thing to double check when you're looking. Is it actually someone that's outpatient, or is it someone here that's home care? So I think that's something that sometimes will trip people up when they're looking through these lists. But I think that's always a good place to start to find a physical therapist. In terms of exercise, some people will keep going to their physical therapist as a personal trainer. I think it's worth asking if there's a gym that you already go to. Sometimes people have found trainers at gyms that actually were either physical therapists or have some experience with the big and loud therapy too. I don't know if I have anyone in the Ann Arbor area that I know of that's a personal trainer though. Love my Rock Steady Buck Steady classes in Michigan, North Carolina, but when I'm not in either of those locations, I love the YouTube sessions. Oh, excellent. I didn't know they had YouTube sessions, but that's great for Rock Steady.
I would absolutely recommend, if you're looking for that information locally, to please give us a call at the office and talk to Angie. She may have some recommendations. And to go back to the LSVT and Big and Loud, those are physical therapy programs that are covered by your insurance. You usually have a copay. But I think it's important to know those are just physical therapy. They only last like 4 to 6 weeks, right? Parkinson's is 24/7, 365 days a week. So you have to really find something that you like and do your part. I'll get off my soapbox. All right. Do we have any other questions or comments? I want to be very respectful. We're right up to the 8 o'clock time. It was a great presentation. I can't thank you enough. Again, I just want to recommend to everybody to check us out on our sampler tomorrow. Is the 101? Yes, the 101 class is good for people with Parkinson's and a caregiver or family member. And you can feel free to reach out to me. Email is best because I travel. I will not be in the office the rest of the week, but the email follows me around. And then, you can give me a call at 248-433-1011. And I'd be happy to give you more information on that. So I'm so proud of all of our Parkies that showed up in great numbers tonight. Thank you, everybody, for joining us. Dr. Heston, thank you again. I hope everybody has a wonderful evening and a great NFL draft weekend. Go Lions. Thank you.
Thank you.
And thanks so much for inviting me.
Good night.
Good one. Bye.